Well, hey guys, welcome back to the Friday Q&A. I have read through your comments over the past few months and I noticed a trend of many of you asking me a lot more questions as of lately if I can do a Q&A or if I can talk about a condition known as dermatographism, what it is and how to make it go away. And as a dermatologist, I see dermatographism a fair amount. It's pretty common. And personally, I have suffered from dermatographism in the past. So in today's video, not only will I talk a little bit about what it is, but I can tell you all the treatments and I can tell you all some tips and tricks that I advise people with dermatographism to put into place and also personally found to be very helpful when I was going through this myself several years ago. So dermatographism, if you're not familiar, is a condition in the family of what is known as an urticaria. Urticaria is a medical word for hives. And hives, if you've ever experienced them, are a type of skin rash, skin lesion that by definition, a hive never stays longer than a few hours. So what that means is that if you see something and you circle it with a pen, if it is a true hive, it should be gone within a few hours, never lasting more than a few days. So dermatographism is an urticaria, is a type of hives. It will actually go away after a few hours. This is in contrast to some other skin diseases where the lesions look a little bit like hives but stay fixed. And I won't get into those for today's purposes. But I think for people dealing with this, you develop these skin lesions and it seems like more and more of them are coming up. But if you pay very careful attention, you will actually see that any one given spot doesn't last very long by itself. It is a type of hive rash, a type of urticaria known as a physical urticaria. And what that means is that it comes out as a result of physical stimuli on the surface of the skin. There are many different types of physical urticarias, hives that can be precipitated by vibration, by cold, by water. And dermatographism is one of the most common physical urticarias, and it is precipitated by stroking of the skin. But what happens in the skin in this condition is something that is known as the triple response of Lewis, but it happens a little bit more aggressively than in ordinary people. What this is that upon stroking the skin, say with your finger or with any kind of friction on the skin, it will result in first a white line, and then that white line will then turn red pretty quickly. And after that, the red line becomes sort of swollen and pale in the center, and will have what's called a flare of redness around it. And that's what really looks angry to people and is alarming. That is a hive, and in the case of dermatographism, because it is precipitated by and brought out in the skin in areas where there is some kind of stroking on the skin, it will just stay right where the stroking was. So you can, if you suffer from this, sometimes during a really bad bout of it, you can actually write on your skin with your finger and a hive will come out that looks like the letters that you have written down. So that is what it looks like. And the given spot doesn't stay for more than a few hours, but people who are going through this can develop recurrences, bouts of it that, come and go several times a day, daily, weekly. The frequency will vary. Now, the exact reason why people develop this is not entirely known. The cell type in the body that makes this come up is something called a mast cell. It releases a chemical called histamine that causes itch. It is responsible for the triple response of Lewis, the red line, the swelling, the flare. And that little chemical, histamine, when the mast cell is physically rubbed or irritated, such as from stroking the skin, it will release histamine. But there are other compounds, other chemicals that our immune system makes that also are likely involved in the pathophysiology of dermatographism. In rare cases, some individuals have an autoimmune disease that is associated with the dermatographism, but for the most part, in most people suffering from dermatographism are actually otherwise healthy. Some conditions or infections can actually trigger this condition, and so it can happen after you may have had a certain type of infection. For example, it's not uncommon for people to develop this after they have gotten over a cold or flu virus. We really have no logical explanation as to why this occurs. It seems as though when your body is trying to fight off the infection, I don't know, it gets a little, exhausted, and it doesn't perform quite right thereafter, and makes this funny rash. Not only can it happen after a cold or flu virus, but it's not uncommon for people to develop this after they have had a fungal infection or after they have had a bout of scabies. Scabies is a mite that burrows into the skin and is incredibly itchy. In fact, it's known as the 7-year itch, because after the scabies is treated and goes away, the individual is plagued with itch for a very long time. And sometimes, in addition to that itch, the individual's immune system can be so annoyed that it rebels and does this rash. So as part of the evaluation of anybody presenting with a skin condition, sometimes some blood work may be needed, but your doctor's going to take a history and perform a physical exam to make sure that none of these things could be clouding the picture. But I think it's very important for you to understand some behavioral things that definitely can exacerbate this and or aggravate it and contribute to its persistence and really just making your life very miserable. So it is actually worsened by hot conditions. Heat really is conducive to mast cell release of histamine. Heat in combination with friction is a recipe for mast cell degranulation and the development of hives. And so anytime, for example, you take a hot shower, this can get flared up, a warm bath, and any kind of rubbing on the skin. Rubbing from a towel after a hot shower. Also, if you scratch, that's going to bring this out. And once you start scratching, you kind of recruit those mast cells into the skin, and they're even more hyperexcitable, and they're right there poised at the surface of the skin, and this kind of kicks off a flare about of these hives. In addition to physically rubbing the skin, this also will frequently flare up and be exacerbated by exercise. But also just minor physical pressure from your clothing, from seat belts, from carrying a bag. Also sometimes, our emotions can be associated with releasing more kind of fight or flight type chemicals that might kick this off. So if, for example, right before you might have to give a speech in front of people, if you get nervous, this could develop or come out. If you, any strong emotion can sometimes exacerbate this. But to remind you, any given spot of this rash, and you look back at it a few hours later, so long as you're not continuously rubbing the skin there, you will see that it goes away after a few hours. Also, alcoholic beverages will exacerbate this condition. So you definitely don't want to pop into a glass of wine when you're coping with this. It will not help at all. It will make it quite unbearable for you. But dermatographism is very unbearable to live with. It flares up sometimes multiple times a day and can really interfere with not only your quality of life, but your ability to comfortably do things of daily living, occupation. Now, the treatment for this is antihistamine medicines. Diphenhydramine can make you very sleepy, but they have non-sedating antihistamines that are sold over the counter as well as prescription, like cetirizine, loratadine, fexofenadine. These go by the names of Allegra, Zyrtec. And so that is typically the recommended treatment. And it is not uncommon for people to have to take multiple antihistamines daily. And I think it's very alarming if you suffer from this to hear that you've got to take all of these antihistamines. But the way the antihistamines work to help this condition is they tone down your body's responsiveness to the histamine chemical that leads to the triple response of Lewis. And I think one of the things that people don't appreciate is that some antihistamines are very quick and short acting, namely diphenhydramine, which goes by the brand name Benadryl, but other antihistamines are more long acting, and non-sedating, meaning they don't make you sleepy or drowsy. And those more long-acting antihistamines, they actually work even better if just taken consistently, because it takes time for the immune system to start quieting that histamine response. And it often takes more medication kind of to build up in your system before you achieve that desired effect. But it's not uncommon to max somebody out on multiple different antihistamines several times a day. It's really a pain for the person suffering with the urticaria, with the hives, because they've got to take antihistamines daily and consistently, and sometimes they have to take many of them, and that's really off-putting to people. People don't like to take one pill. If you bump it up to 2 pills, compliance goes down. But in this condition, we often have to bump it up to 4 or 5 pills sometimes of different antihistamines. So compliance on the part of the individual is really hard to keep up with, you know, having to take all of these pills, and people get annoyed with it and frustrated. But they don't have to be, they usually are not continued indefinitely for the life of the person, because this condition usually will kind of burn out after a few years at the most. And so the way that it is generally managed, an approach to generally managing it, is that you follow up with your doctor, say you've no longer been suffering from this, and then one at a time they will start peeling off some of the antihistamine pills. 1 pill for a few weeks, see how things go. So it's not something that you've got to be on all these pills for life, but it can take a very long time to retrain your immune system and your body to stop doing this. Outside of the medications, the other thing though is modifying behaviors to avoid aggravating this and exacerbating it. Avoiding hot showers and hot baths. If you live somewhere that's really hot, you know, definitely avoid the peak heat times of the day and try and stay indoors where it's cool. Because that heat is just going to rev this up. Avoid using towels. This is something I had to teach myself. I stopped using towels many years ago because when you use a towel after the shower, you're rubbing the skin, and so that can obviously bring this out. Plus you've just gotten out of a warm bath or a warm shower. So the two factors together really meet and can make this quite bad. But that's not always the easiest thing to do. I was able to do it. I just stand and drip dry on a bamboo bath mat, and I find that I dry pretty easily and don't get chilled. But it's not going to be easy for everybody. The alternative is to just gently pat the skin dry with a towel rather than rubbing it. Your clothing choice is huge. No leggings. You know, I love Fabletics, but you know, no leggings. Leggings, tight clothing, tight jeans in particular, can make this quite unbearable. Tight, you know, you have to wear your seatbelt, but taking care when you put seatbelts on is also the other thing. If you do it quickly, that's more of an abrupt force that can elicit this. So very carefully and kind of place it. I mean, it is annoying to do that, but that will help. Also, when you put your clothes on, put them on very slowly, particularly at nighttime when you've just gotten out, if you've just taken a shower or bath. Slip your clothing on really slowly, one leg at a time for the pants. You know, don't quickly pull up your pants or pull on the shirt over it, because that kind of abrupt frictional force can aggravate this. So you have to go almost in slow motion when you're putting your clothing on. It feels bizarre, but it does help. I think one of the trickiest things though is that the skin feels very itchy, and you may also have some element of dry skin to begin with, and so you have a compulsion to scratch the surface of the skin. Scratching the skin, unfortunately, is the worst thing you can do. By definition, that's what causes this to come out. So if you have itch, a tip is to keep a moisturizer in the fridge and keep it cold. People always ask me about refrigerating skincare products. This is a situation where it's really helpful to do this. For refrigerating your moisturizer, a moisturizing cream, I will list some down below for you guys, but you know the usual suspects if you've been watching any number of my videos: CeraVe, Vanity Cream, QV, etc. Keep it in the fridge and put it on the skin gently, patting it on instead of rubbing, because rubbing is going to bring out the dermatographism. It's a friction on the skin. Pat it on the skin. The cool temperature will distract some of those itching nerves and help soothe the skin and keep you from setting off a bout of this. So that is another tip. But it can be very difficult to live with this, and following up with your healthcare provider is very important, because if it doesn't get better, you know, there's a stepwise, a ladder approach towards treatment, and so following up, you know, with a dermatologist can really help to get this controlled for you. And stay optimistic. It does burn out in the vast majority of people, albeit it can take a long time. So stay patient, stay optimistic, and I hope these tips help for you guys as far as behavioral things. And if you like this video, give it a thumbs up, share it with your friends, and as always, don't forget, sunscreen and subscribe. I'll talk to you guys tomorrow. Bye.